16 months ago, you gave your commitment that you would do your best to defend hospital services at Navan. And indeed, on the invitation of the Save Navan Hospital campaign, you addressed the 10,000 strong crowd and that public rally, and you said that there would be no more cuts that would put people's health and lives in danger. And Fine Gael candidates in the constituency stood on the election promise that they would ensure that a new regional hospital would be built in Meath within the lifetime of this Dáil. Ara, you're also aware of the trolley count in Our Lady of Lourdes Hospital in Drogheda. And from my perspective, it's a disaster. It's one of the highest in the state. And now work has been carried out under your direction, which has ameliorated the problem to a certain level, and we appreciate that fact. But still the figures are stubbornly way too high. In 2010, for the first 6 months, 1,664 people were forced to wait on trolleys. In the first 6 months of 2011, 3,266 people were forced to wait on trolleys. And this year, the INMO have said from January to April that 2,422 patients were treated on trolleys in Drogheda. Now, in each of these occasions, little is offered to the patients with regards to privacy and dignity. In each of these occasions are seriously suboptimal with regards to treatment. And I'm not trying to draw any direct comparison to the tragic and shocking situation of Tala, but what happens makes people very, very cautious of allowing trolley counts to remain so high. I also just want to bring your attention to what happened in Cavan when Monaghan's ED was closed. The trolley count rose from 746 people in the first 6 months of 2009 to 1,443 people in 2010 and 2,745 people in the 6 months in 2011. And this increase came from the closure of Monaghan's ED. In the last few weeks, Minister, you'll be aware that a document was leaked from the HSE, and indeed the HSE, in fairness to them, have indicated that it reflects fairly well on their current objectives. It doesn't hide behind the rhetoric of the previous government in any way, and it's entitled the Louth Meath Hospital Group Cost Containment Draft Projects Plan. The document details the closure of our ED in Navan. It details the reduction of 3 locum consultant positions. It details extended closures of orthopaedic services and the reduction of surgical inpatient activity. These closures will occur despite shockingly high orthopaedic and surgical waiting times. Now, the savings that will be achieved from the part closure of the ED in Navan, we're told, will total around €800,000. This does not take into consideration the cost of treating these patients in other ED emergency departments or the cost of transport. Now, I appreciate, Minister, that you have taken a different attitude towards the health service in the Louth Meath area, and I appreciate the change of direction you've taken from the last Minister. And I will also recognise the work that has been carried out by Fine Gael TDs and Labour TDs in Meath in partnership with the hospital campaign over the last year, and I respect that. But I will say that crunch time is coming for our hospital, I believe. And it's now or never really with regards, I believe, living up to promises and translating that into action. So I'll just ask the Minister here today, will he commit to maintaining services at Our Lady's Hospital, Navan's ED?
Thank you, Deputy Minister. 4 minutes.
Well, I indeed remember very well the meetings to which the Deputy refers. And I certainly know that at no time did I promise to keep the emergency department of Navan open indefinitely. But I have made it very clear since becoming Minister for Health that with an emergency department in Cavan, in Navan, in Blanchardstown, all on the M3, and another one just across the way in Drogheda, longer term, this is an emergency department that will have to be reviewed. But in the current situation where there is such, as the Deputy rightly points out, a capacity issue, there is no question of any reduction in the service at Navan Hospital's emergency department. So I just want to say that at the outset. And I want to acknowledge the hard work and dedication of the accident and emergency services at Navan Hospital. The staff that ensure that patients are treated in a dignified and respectful manner, even when they may have to wait for treatment or admission. And this government is committed to securing and developing our smaller hospitals to provide more services, not fewer. However, these services, including emergency care, must be the right service and be safely delivered. HIC has pointed out the type of patient who can safely be treated in different hospitals, depending in particular on the volumes of patients seen with each condition. Smaller hospitals treat only small numbers of patients with complex or acutely life-threatening conditions in scheduled and emergency care. This means clinical staff do not treat certain conditions frequently enough to ensure their skill levels. These patients may also require specialised resources, including advanced life support machines and complex surgical facilities, which are not feasible in many small hospitals. Accordingly, for certain conditions, small hospitals cannot ensure the best care, and patients need to be directed to the care pathway appropriate to their needs to ensure best outcomes. The HSE clinical programmes delineate acute hospital services based upon the safe provision of patient care for given facilities, staff resources and local factors. Under this framework, the future growth in healthcare for local populations is firmly in local hospitals for ambulatory care, diagnostics, rehab and with close links to primary healthcare. Suitable services for expansion in smaller hospitals include minor injury units and urgent care centres, day surgery including cataract, hernia and other surgery safe for day provision, ambulatory care including chronic disease management and assessment for older persons, medical services including cardiac failure clinics, cardiac rehab, chronic obstructive pulmonary disease, outreach clinics, and rheumatology, dermatology, diabetes and rehab. Diagnostics including blood tests, x-rays, endoscopy and bronchoscopy. The HSE is reviewing all services against its cost containment plans. A number of proposals are considered for Navan, and the HSE is focusing on improving emergency department and related services at Drogheda. The HSE has been engaging with the Navan Hospital Alliance and will continue to do so. Under the Public Service Agreement, there will also be engagement with staff and staff representatives. However, the HSE has informed my department that there will be no significant service changes at Navan or Dundalk pending the outcome of the discussions. We need to ensure that hospitals deliver on the special delivery units access requirements within government budgets and HICWA's safety and quality requirements. The best way forward for smaller hospitals is to operate initially within hospital groups and ultimately within the proposed independent hospital trusts. Consultation on these groups will commence this week with hospitals and other key stakeholders. Thank you.
Thank you, Minister.
Good morning, Ara. I suppose central to this whole reconfiguration process at the very start, the one that was signed up to by health professionals in the northeast, was that this process would include the building of a new regional hospital. And this new regional hospital has not materialised. And I do hear much good, believable medical advice to say that, you need to have a certain level of throughput for procedures to be clinically safe. However, nowhere can I find, and I mean absolutely no medical professional will say that, reducing the services that are there in the hospitals that are there for people not to get any service because of waiting lists, or not to actually be seen at a proper time because they're on a trolley for a long period of time, is sufficient. So we're told that, that we're going to create a new medical order where you would have increased medical procedure numbers leading to better outcomes. But the elephant in the room is that the choice is today that individuals are not given the option of those improved clinical procedures. They're given the option of longer waiting lists or trolleys. And that is the elephant in the room. Now, you mentioned there that there will be no significant service, and I suppose what I would like to clarify, and I'd appreciate if you can clarify it, would be, does that include there'll be no overnight or part closure of the ED until the necessary capacity is there? And the hospital campaign would be very strong in the view that we will fight, I suppose, for the ED until such time as that there's a new regional hospital. But I will say that we look forward and hope to work with you in partnership over the next period of time. We mightn't agree on absolutely everything in the future, But there's no doubt over the next year or so that we should be able to, we hope to work in partnership with yourself on achieving some of our shared objectives. Because I suppose just to relate a meeting in the hospital campaign of last Wednesday, a lot of individuals were there and they told of their own personal experiences of landing in the A&E in Navan and of their lives either being saved or at the very least their health being repaired by the existence of that. And it's the personal stories, the hundreds and the thousands of personal stories that need to be remembered in these occasions. And as a result of those personal stories and personal experiences, it was communicated at the hospital campaign from the floor that people would do their utmost and mobilize if necessary, I suppose, into the future. We hope that that time doesn't come, that we can work in partnership.